Welcome to Thursday's edition of COVID-19. Over 5 billion doses of COVID-19 vaccines have been administered across 183 countries, including here in Korea, where authorities are marking 6 months since the launch of their inoculation campaign. Now, do stay with us for more on that later on the program. Here first is the broader pandemic coverage with our Kwon So-ah. Now, So I hear there's been a slight decline here in the country.
Right, Sunny, we are down to below 2,000 cases, but not a sign of relief as of yet. Almost 1,900 infections were reported as of 12 a.m. this Thursday. We are, however, seeing a plunge in domestic transmissions by around 280 compared to yesterday, but around a dozen more imported cases compared to a day ago. A drop has been reported in the metropolitan region in Seoul, Gyeonggi-do province, as well as Incheon. Also here in the southeastern part of the country, no triple digits compared to yesterday. We are seeing some declines here, but Chungcheongnam-do province is seeing quite a surge, close to 100 cases now. So we are still seeing all 17 provinces or major cities affected by the virus this Thursday. And if we go over to our graph, we are seeing that today's figure is roughly the average number of cases in the past week. What's especially concerning today is the death toll. We're seeing 20 additional fatalities related to COVID-19. This is the highest figure we're seeing during the fourth wave of the virus. And the highest ever daily death toll we saw before was in late December at 40. And out of the roughly 28,200 people remaining in quarantine or under treatment, there are also more than 400 patients in severe or critical condition. Now, seriously ill patients are not only confined to the elderly citizens anymore, making vaccination for every age group all the more important. And mass inoculations have kicked off this Thursday for regular citizens aged 18 to 49. As of Wednesday, around 67% have made their bookings so far, and registration will be open until the 18th. And actual inoculations will continue until October 2nd. So far, we've got 27 million people who have received at least one dose of COVID-19 vaccine and roughly 13.3 million who are fully vaccinated.
Right, and staying on the vaccination front, so I hear there have been more findings about booster shots.
Right, Sunny. U.S. vaccine maker Pfizer said on Wednesday local time it is seeking approval from the FDA for booster shots for people aged 16 and above. And as we know, that would mean a third dose. And a recent study showed that a second dose of the single-dose Johnson & Johnson Janssen vaccine has been found to raise antibodies ninefold 28 days after receiving the first dose. But despite these developments, though, the World Health Organization remains firm on its stance that the idea of administering booster shots should be delayed for now. So here's a recent remark by the WHO chief.
On the boosters, first of all, it's not conclusive in terms of its benefits. And also, we don't know if it's safe. And the second problem is when some countries afford to have a booster and others are not even vaccinating the first and second round, it's like saying, okay, you have a life jacket and you're adding another one, while others don't have a single life jacket.
So the chief is stressing that this is a moral issue, but many countries are seeking these booster shots because numbers are rising, especially over the concerns over the Delta variant spread. Let's check some of the numbers here. The U.S. here has 39.1 million cases, fiercely approaching the 40 million mark, followed by 32.5 million in India and 20 million cases in Brazil. Also, Italy in the past day has surpassed 4.5 million cases in total. And in overall, we are seeing more than 722,000 infections reported in the past 24 hours as of noon Korea time, which has raised the total to 214.7 million. And those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, on the domestic front, the framework of special COVID-19 prevention guidelines for the Chuseok holiday will be announced early next week. Now, for more on this and on the country's inoculation drive, I have Choi Won-jung here in the studio with me. Welcome, Won-jung.
Good to be here.
Right, first up then, as Soa mentioned today, that is Thursday, vaccinations for those aged between 18 and 49 are underway, right?
Right, so like you said, Korea has started administering the first shot to those between 18 to 49. And starting Thursday, which is today here, those who made their bookings will be getting mRNA vaccines from either Pfizer or Moderna at designated vaccination centers. Also on this day, more than 30,000 people, including those with disabilities and staff working at rehab centers for disabled, will be getting their vaccines as well.
Right. Now, Won-jung, I also hear a number of people have the opportunity to reschedule for earlier inoculation appointments. Could you tell us more about that?
Sure. So some 200,000 people with appointments scheduled after Chuseok, now they have moved their vaccination appointments before the holiday period, with Korea set to receive 7 million additional Moderna vaccines over a 2-week period. Eligible recipients, recipients now have more dates to choose from. Take a look at the slide up on your screen right now. If you want to reschedule your existing appointment to date between September 6th and 12th, they can do so until midnight August 26th. But if you prefer to get vaccinated between September 13th and 19th, midnight on September 2nd is the registration deadline. For example, my vaccination appointment is on September 30th, so which is after Chuseok holiday and more than a month from now. But if I rebook my appointment, I could get my shot in as early as 2 weeks. And the Korean health authorities stressed the importance of vaccinating 70% of the nation's population before Chuseok, which could help lower the number of daily cases.
Right, hopefully that will be the case. And finally, Won-jung, as I mentioned at the start, authorities will make public their special prevention guidelines for the Chuseok holiday at the end of this month.
Right, so with Chuseok coming up less than a month now, the Korean health authority said Thursday the detailed prevention guidelines for the holiday period will be shared with the public before August 31st. But as of now, they have announced measures to limit the sales of train tickets for those planning to travel, which will only be sold online to prevent large crowds lining up in front of ticket counters at train stations nationwide. Here's the schedule up on your screen right now. For Korea, ticket sales will begin next Tuesday until Thursday, and SRT ticket sales bookings will start on September 7th and run to 9th, and they will only be selling window seats for now because of social distancing rules. And the health authority also touched upon air travel during the Q&A session after the government briefing on Wednesday. They said there was a low chance of the virus spreading within the aircraft due to their air circulation system, and that detailed air travel guidelines will be announced next week as well. The health authorities are also assessing the risk of COVID-19 on board high-speed trains like KTX and said they will share further details at a later date. However, one expert told us over the phone that public transportation in general makes contact tracing very, very challenging for health authorities. Take a listen.
Last year, I urged you to reconsider your travel plans. If you have no choice, please use your own personal vehicles. If you have to use public transit, you must follow the guidelines that have been set for each mode of transport.
Like I said earlier, health authorities will continue to monitor the current fourth wave of infections and vaccination rate and decide whether additional measures are needed later this month.
I see. All right, Won-jung, as always, thank you very much for that coverage.
Thanks for having me.
Right, up next, we bring you the regular afternoon briefing on the pandemic situation here on the local front for this Thursday. Now, social distancing guidelines under level 3 and 4 are in place nationwide, but with a few modifications. The most tangible of these changes are those that affect drinking and dining establishments, including such services provided at some convenience stores. Under level 4, these venues can accommodate patrons until 9 p.m., while under level 3, the in-house catering ends at 10 p.m. Also, in the case of social gatherings under level 4, a total of 4 people can meet even after 6 p.m. if 2 are fully inoculated. Let's now take a closer look. Level 4 restrictions are in place here, as well as in a few other regions nationwide. Up to 4 people are allowed to meet for social purposes until 6 in the evening, and after 6, only 2 people can do so. But should the party include 2 people who are fully vaccinated, as I mentioned earlier, up to 4 people can gather socially even after 6 p.m. Weddings and funerals can have up to 49 people in attendance, while only one-person rallies are permitted. Also, under this level, workplaces for their part need to ensure that 30% of their workforce is working from home. The briefing is about to start. We'll come back to you afterwards.
TV로도 생중계되고 있으니 시청하시는 분들
Our
중에
briefing
궁금한
is
점이
being
있으면
live
질문
broadcasted
보내주시기
nationwide,
바랍니다.
so if you have any questions,
그럼 먼저
please raise your question to us
브리핑 설명이
afterwards.
있겠습니다.
And first of all, here is Commissioner Chung Eun-kyung of the KDCA for today's briefing.
네, 8월 26일 정례 브리핑을
Let us now begin our regular
시작하겠습니다.
briefing for August 26th. First of all, on the vaccination front, here are some details. As of today, those who have completed their first dose inoculation stands at over 27 million, which is about 52.7% of the total population here in South Korea. And we have 26% of the population being fully vaccinated. And by age group, we have also some details. And as for the first dose, for those over the age of 60, we have more than 95 people being inoculated with their first dose. And also, for the 50s, we have also 83%. And also, we are rolling out the vaccination for those between the ages of 18 and 49. And we have a total of 8.14 million who have already been vaccinated through our advanced inoculation systems. And out of these age bracket, we have about 67.2% of the population who have also made the reservations for the vaccination appointments. And we believe that about 81.5% will be getting the shots or are willing to do so due to advanced inoculation programs. And if you have not yet booked your reservation, please do so until the September 18th. And also, we have made available for these age brackets people to also reschedule their vaccination appointments to before a Chuseok holiday. So please make use of that as well. And today we are kicking off our vaccination for people aged 18 to 49. And starting from 26th of April and 9th and the 5th of September, that is, we are also giving out the Pfizer vaccines, and we will be also giving out personal information and notification of the other weeks depending on our supply of the vaccines. And please note that the type of the vaccine could be subject to change depending our vaccine supply here in the country. And in order to ensure a safe vaccination environment, we ask you to take particular precautions as well. So all of the recipients need to monitor your conditions for the next 15 to 30 minutes after inoculation at the designated vaccination sites. And also, even after returning home, please monitor your conditions for the next 3 hours. And for at least 3 days, please take particular note of your health conditions. And if you have a high fever or other symptoms, please also visit a doctor as soon as possible. And as for this group of people, they are subject to the Pfizer or Moderna vaccines. And please note that mRNA vaccines could have rare cases of the heart inflammation cases. So we ask you to take particular notion of that. And if you are also experiencing heart pain, chest pain, or also shortness of breathing, we ask you to go to the doctor as soon as possible. Moreover, we have also some of the COVID-19 infections among this age group, and those between the ages of 20 and 49. We have seen that about 11 million people have been infected with the COVID-19, and also we have about 18% of them in their 20s, and also for about 14% in their 40s. And we see that the 20s also account for the largest proportion of the COVID-19 infections. And we have a total of 41 deaths in this age group, which is about 1.8% of the total COVID-19 related death. And we had 8 people in their 20s and 11 people in their 30s and 22 to in their 40s, and we believe that the fatality rate for this age bracket stands at about 0.43%. And as for critically ill symptoms, we have also a total of 719 people in this age bracket going through severe symptoms, and by proportion, this is about 0.06%, and 67 people are in their 20s, and also 139 in their 30s, and about 450 were in their 40s. And during the past 7 weeks, we have been looking at the Delta variant. And also under this fourth wave, we see the age bracket of 20 and 49. This age bracket had the highest proportion of the infections. And we are also seeing an increase in the infections among this age group. And by sources of infection, we have also noted that there is more, over 40% of the cases stemming from people-to-people contact, including their family members and their friends and so forth. And for the past 7 weeks, we have seen also 470 cases of critically ill symptoms, and also 58% of the total critically ill patients have been occurring in this fourth wave. And a majority of them, about 412 people, were not inoculated, and only one person have been fully inoculated among these people. And also, as for the people in the age bracket of 20 and 40s, we have seen that about 11 of them were in this age group. And we also note that they have also had many of them had underlying illnesses. And also in this age bracket, our inoculation plans are as follows. And also, we have been carrying out some analysis for those who have received their vaccines in this age group. And we have notified that a majority of them have been not inoculated, and also some of them have been inoculated as well. And as for the effectiveness of the vaccine on preventing the critical ill symptoms, we have also done some analysis about for the 48 hours after the COVID-19 infections, and we have also saw that about 290 cases experienced these severe symptoms, and we have seen that only one person have developed critical symptoms even after being fully inoculated. And also we have seen 0 cases of death in this age group who have been inoculated, and we also concluded that the vaccine is effective in preventing severe symptoms and death. And as for this age group, we have been carrying out our inoculation, and about 55,000 cases of the adverse responses have been reported so far, and about 97% are mild symptoms and 3% are severe symptoms, and these have been reported so far. And as the age increases, we also have seen a higher proportion of such post-inoculation adverse responses. And as for the major adverse responses in this age group, we have had about 443 cases that have been screened by our damage compensation committee, and 2 of the cases of death have been deemed to have the correlation with COVID-19 vaccine. And as for 14 cases, we have seen to have no relation with the COVID-19 vaccine. And last but not least, here are some updates on the supply of the vaccines. And we also have about 830,000 doses of the AstraZeneca vaccines under the COVAX facility to arrive, and about 1.4 million of AstraZeneca vaccines will be shipped from Andong tomorrow. Thank you very much.
Right, there was Chung Young with Thursday's afternoon briefing, and I have Soa back at the desk with a summary of her address, right?
Right. Well, a special briefing is being held this Thursday after Chung Eun-kyung's briefing part. There's also going to be a Q&A on the vaccination progress, and that because today is the first day of the inoculations from people aged 18 to 49. And so far, 35.6% in that age group have been already inoculated, according to Chung, because many people have made use of the surplus system, as well as were part of private prioritize groups such as essential workers to society. And Chung also mentioned that everyone between August 26th and September 5th will receive Pfizer shots, no matter where in the country you reside in. But following that, the types of vaccines will be notified through text messages. And she also asked for the citizens' understanding that the type of vaccine can change depending on the supply situation at those medical facilities. She also mentioned that there's been a rise in patients among the younger population between 20 and their 40s in the past 7 weeks. That is also why we are seeing a higher number of people in critical or serious situation in that age group. And that she attributed this to the Delta variant spread.
Right. And so before I let you go, just for the sake of clarity, when will the government be announcing these special COVID-19 prevention guidelines for the Chuseok holiday?
The government is expected to make that before the 31st of August because the 31st is the day when the reservations for train tickets will start. So before that day, they are expected to make that special announcement.
I see. All right. So as always, thank you very much for that.
My pleasure.
계획대로 잘 진행된다면 9월 말까지 전 국민의 70%가 1차 접종을 받고 고령층을 비롯한 취약계층을 중심으로 국민의 50% 가까이가 완전 접종을 완료하게 될 것입니다.
Korea's COVID-19 vaccination drive began on the 26th of February, and 6 months later, that is today, authorities have administered at least one dose to more than half of the population here. The goal now is to offer one dose of the COVID-19 vaccine to 70% of the population before the start of the Chuseok holiday. For more on this, I have Professor Kim Min-gyu from Yonsei University. Welcome back, Professor Kim.
Thank you for having me.
I also have Dr. David Kwak from Soonchang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Meanwhile, joining our session virtually is Professor Sanjaya Sinanayake at the Australian National University. Pleasure to have you back with us, Professor Sinanayake.
Thank you for having me.
Right. Professor Kim, here in the studio, let's begin with your assessment of Korea's inoculation campaign over the past 6 months.
Yes, most of the Koreans are well willing to have the vaccination, and if you look at other countries, for average, about 40% of the population are willing to get vaccination, and 40 are in the middle, and about 20 are very reluctant to it. I mean, they are negative. Well, for Korea, the supply of vaccine did not match the need of the population through this 6 months, and people who plan to travel abroad, they just got a vaccination and came back if possible. So some people call it vaccine tourism. Whenever the vaccine was available, I noticed there's a steep rise in the vaccination rate in Korea. So some countries like Israel or UK or United States, they have to think about some incentives to make the vaccination rate more faster, rising faster. But actually, Korea didn't reach that level for the 6 months. Maybe if the Delta variant did not appear, I think the situation might be quite different. And we might have to think about some intense incentives, but Delta variant changed the whole situation. And as I mentioned last time, it's like the hare and the tortoise racing. And actually, we are fighting against a moving target. I mean, RNA virus never stay as it is. It always try to mutate, and we might have a new variant emerge in the future. So that's the reason we still need that social distancing and maybe vaccination, including the booster, and still we need some special medication, drug to treat the patients. Even though vaccine cannot prevent some breakthrough infections and transmission, I consider that the vaccine saved many people from death and getting severe COVID-19. And finally, it's a pity that we're still in the process of developing our own vaccine right now.
Right, we are there. Dr. Kwak, it took Korea 3 months to offer one dose to 10% of the population, but the country topped 50%, the 50% mark that is, 3 months later. How do you explain the accelerated rollout?
Well, I think it's more of a physical obvious issue that in the beginning we were lacking in the supply of the dosage into the country, but soon after we were getting the dosage in, and the influx of it were enough to cover the rest of the 50% that we covered within the 6 month period. Also, as Dr. Kim already mentioned, most of the population are very eager to get the vaccines once they're allowed to. Once they become available, those who are allotted to each different time lots, they were very eager to just go straight ahead and get the vaccines for themselves. So it was really mainly the matter of whether the supply was actually in the country or not that could be inoculated to the people. I don't think the confusion or misconception that people had, such as that is happening, let's say, in the Western countries, are really something that we need to be worrying about here, because the reluctancy or the hesitancy among rather younger generations is not, I don't think, mainly from their political stance against the vaccine, but rather it's more of the issue with their timing and their scheduling, and also with their understanding of the vaccine. So once again, going back to the original question, I think it was more a matter of the supply that we could have to the people in the nation. That's what got up to the 50% mark that we marked today.
Right. Professor Sinaneaki, I believe Australia's vaccination drive began around the same time as did Korea's in late February. What can you tell us about the campaign there?
So yes, we started late. I think a lot of countries like South Korea, New Zealand and Australia, who did very well at controlling COVID, felt that we had some degree of opportunity to watch and see how the vaccine rollout unfolded in the Northern Hemisphere parts, Europe and the United States, where they were having a lot of disease. But then we got into our vaccination program in late February, having seen what was happening in places like Europe and the US. And it's been a bit of a stop and start program. It was slow at the start. And as Dr. Kim and Dr. Kwak have said, supply was also an issue for us, particularly getting supply from Europe at the start. Now in Australia, we have CSL, which is producing about 1 million doses of AstraZeneca a week. We are starting to get significant amounts of the mRNA vaccines, particularly Pfizer, coming into the country. We'll have about 4 million next month, 10 million in November, and about 6 million in December, with many millions of Moderna vaccine coming in. But we also have to deal with the issues of AstraZeneca, the AstraZeneca vaccine and clotting, where the messaging around that probably could have been a lot better and encouraged more vaccination.
Right. Professor Kim, research claims that vaccine-induced protection against COVID-19 starts to wane after 6 months, which is why we're talking about booster shots, much to the dismay of the WHO. Is there no other alternative aside from booster shots?
Booster shot has a long history, actually. We developed many kinds of vaccines, and they start that it might be effective lifelong, but many cases we need a booster like MMR or DPT and many kinds of vaccines. Effectiveness of RNA vaccine dropped from 92% to 80% since the outbreak of Delta variant. And the US government said that the booster shot is recommended 8 months after the second shot. And FDA is still not determined yet. And they're not even determined with other vaccines such as Janssen and AstraZeneca. Well, antibody test is a good and available method to check immunity. But that is not all. We also have T cells. T cells immunity is also important. But the problem is it's almost impossible to check routinely. So I would like to share an article from medical journal Nature that reviewed 23 cases who survived SARS of 2003. And they checked whether they still have that immunity against SARS. 17 years later, they still have some T cell responses. And there's also a possibility that that T cell immunity might work against SARS-CoV-2, which is the COVID-19 we have right now. So we always talk about antibody test and it's weaning after 6 months or 8 months, but we have to remember we have also T cells and we also have innate immune cells such as NK cells and monocytes. For Korea, I think increasing vaccination rate is a priority right now, and for immune-compromised patients such as cancer patients and many patients with chronic disease, they really have a real rapid decline of antibody after vaccination. So if we have to do the booster shots, I think they will be the #1 priority.
Right. And staying with booster shots, Professor Senanayake, what is Australia's stance on booster shots?
So we don't have an official stance on booster shots at the moment. And the reason is, of course, because we still have to get a significant proportion of the population finishing their standard vaccination with 2 doses of the vaccine. So currently we've got about just over 50% of the population, eligible population, who've received 1 dose of vaccine, and about 31% who are fully vaccinated. So we really need to get that up to speed before we start thinking about boosters. But as Dr. Kim was saying, I think it was always inevitable that the issue of boosters was going to come up, and it is something we will have to think about in the future. And we also have to balance this up with the fact that a large proportion of the developing world is very far behind on their primary vaccinations. And if we don't ensure that they get vaccinated, then variants far worse than Delta could appear. So it is a fine balance, making sure that we get our booster shots, but also ensuring in a timely manner that people in the developing world get their first 2 shots.
Right, of course, that was a concern brought up by the WHO earlier on in the program. Dr. Kwak, meanwhile, back here in the country, vaccine reservations among those between the ages of 18 and 49 stand at around 65%. Now, the government had hoped for at least 70%. How do you explain the discrepancy?
Well, my speculation is mainly 2 things. Number one, there is a more of a misconception among younger generations that if they were to be infected, they would go off more easy with the disease compared to the older generations. Meaning, if they're infected with COVID-19, there's the conception that those younger generations would have it much easier with much milder symptoms or maybe no symptoms at all. So we need to give them the right picture that even as of now, we are having admissions of people in their very younger 30s and younger 40s with severe symptoms that have as much of the severity as the older generations do. Number 2, these are the generations that has a lot to do of work. They are the generations that are currently still working very hard, having to go to different companies and schools and whatnot. So if we don't allow them to have, let's say, a certain break or incentives for getting the shots, it'll be very hard for them to schedule even to receive a vaccine. A friend of mine, acquaintance of mine, was quite hesitant towards getting the vaccine. She was in her 20s, she was particularly 28 years of age, because she was not sure whether her company would allow her to have a time of break after the vaccine if she was to have side effects. So these are some of the social issues that we have to take care of before letting the younger generations go ahead and freely get the vaccines. My suggestion, my personal suggestion, however unrealistic it may sound, is that maybe mandating all companies to allow at least 3 days of rest after the vaccines to make sure that they also be observed for any possibilities of side effects, number one, but also number two, sort of as an incentive that once you get the vaccines, you'll be allowed to take some rest afterwards.
Right. So aside from mandating vaccine holidays, Professor Kim, what do you propose then to further boost inoculation among younger adults?
Well, I think I have the same opinion with Dr. Kwak. They are very active in generation, so there are many works to do, and if they don't have a secure time to take a rest, it makes them to delay their vaccination or think about other choices. And actually, we now have a relatively clear criteria for risk groups, and I don't know exactly who is getting worse in that 20 to 40 generation, but if there is such a disease like diabetes or severe obesity, they are still young, but they belong to a high-risk group. So even though you are young, if you have some that kind of comorbidity, they should have a priority getting vaccination and the proper treatment and early diagnosis. So actually, they have to take care of themselves, and overworking is causing a lot of trouble. Before the pandemic, even young, you can die of influenza if you work too hard and you make your body too tired. So I would like to emphasize on that.
Right. And Professor Sinanayake, what efforts are being made by authorities over in Australia to promote public inoculation?
Right. So right now we are in the midst of a very large outbreak of Delta, particularly in Greater Sydney, our most populous city. But also where I am in Canberra, we're having an outbreak, and Melbourne is also having an outbreak. And as you well know, Delta is very infectious in all age groups, and we're finding that the young and the socially mobile youth are the ones who are accounting for the majority of the infections. But of course, what we're also seeing in Australia is that a lot of young people are getting admitted to hospital, including to intensive care. So the government has been focusing on that message, that even young people can get very sick with Delta, in order to try and promote vaccination. Now, we talked about how slow the rollout was in Australia earlier on, partly because we had very little disease and we've been so good at controlling it. But just like the Northern Hemisphere, the US and Europe, when we start to get a lot of disease in Sydney and a big outbreak, everyone suddenly wanted to get vaccinated. So that was the biggest incentive of all. And the government has come on board, both the federal and state governments, in trying to open up a number of venues to give vaccination to people of all ages. And even from next week, potentially 30 to 39-year-olds will be eligible for the Pfizer vaccine, which they weren't up to this point. So in the midst of an outbreak, a lot of resources have been put towards getting people vaccinated. But people here are scared and they want to get vaccinated.
Right. Professor Kim, there are concerns of possible mishaps during vaccine administration, such as a mix-up of dosages or of vaccines themselves. How can we seek to avoid such scenarios?
Well, I heard that there are some cases who had injection from normal saline, and some people have 5 doses at once, and some even less than 1 dose. And I had a phone call from my friend that he insists that his friend had 2 shots with different kinds, but I think there was some kind of mistake, so I think the nurse just withdraw the wrong one and put the right one next time. Well, it happens, but it's very rare, and I think we had more than 13,000 shots in Korea, and the error happened only about 100 cases, I guess. I know that they're using stickers. So if you're getting Pfizer, we write Hua and you put a ticket on your clothes so the nurse can see it and know that the patient's going to have the right vaccine. They use stickers, and I think one of the most important thing is the vaccinee should know what kind of vaccine he's going to get. And the nurse has to double check, ask the vaccinee about what are you going to have and check whether it's right. Actually, in hospital, we always do like that, especially when we do transfusion. We know our blood type and nurses know, but even though everything is all going well, we check and ask again and again. So I think that's kind of procedure that is what we need. And I think we should make efforts to make sure that the vaccine error does not lead to mistrust of vaccines.
Right. Staying with these possible mishaps, Dr. Kwak, Moderna vaccines were incorrectly administered to dozens of people who had been due for their second shots of the AstraZeneca vaccine in the eastern city of Gangneung recently. Now, cross-inoculation using AstraZeneca and Moderna have not been approved in the country as far as I know. What are the possible risks here?
I anticipate there's not going to be that much of a risk because all in all, whether that be through viral vector type of the vaccines or mRNA type of vaccines, they work pretty much in the same way in a sense that they're trying to provoke our body's immunity to build up antibodies against a certain part of morphological virus. So mRNA is just attacking the mRNA attachment site within the cell to provoke that. And viral vector type is basically hanging onto the virus to get into the cell to, once again, provoke the same mechanism. So I don't think shooting Moderna shots instead of Pfizer to the cross-matching people is really going to make big of a difference in a sense that it's going to drastically cause another strong side effect. On the other hand, we still should be careful because the reason it hasn't been approved yet is because we don't have studies prove that it's completely safe to do so. We only have a number of studies that showed Pfizer cross-matching with first AstraZeneca shot is at least safe to do so, relatively speaking, based on several hundreds of people that they studied on. So that's how it was improved. But with Moderna, that was never studied. So it's not allowed to be done. But in a sense that they both share the same method and mechanism to provoke antibodies within the body, I think having made that mistake is really not going to cause somebody to suddenly show a drastic side effect.
Right. Unfortunately, we haven't heard of any such event as of yet. Now, staying with cross-inoculation, Professor Sinaniaki, again, what is Australia's stance on this method of vaccine delivery, cross-inoculation?
So at the moment, we are not officially mixing and matching or cross-inoculation, whatever you would like to call it. As Dr. Kwak was saying, there are some studies out there, the Comcov study in the UK. There's been a German paper, a Spanish paper about mixing and matching. And even in, I think, Azerbaijan, they're doing an AstraZeneca and Sputnik dose. So they're trying to see if this is a successful way of generating immunity. And certainly in terms of antibody levels, giving an AstraZeneca followed by a Pfizer seems to be very successful. The limitations are, as Dr. Kwak says, we just need to follow subjects in those studies to see if it is a safe method of doing it. And of course, the other thing is just because something increases your antibodies doesn't necessarily mean that it's going to translate into clinical effectiveness against infection. Look, it probably will, but we don't know that for sure. And even though we're not doing it in Australia, some other countries in the world are mixing and matching vaccines. And in Australia, although it's not official policy for everyone to get it, if someone has reacted to AstraZeneca, for instance, they will get a Pfizer vaccine shot for their second dose. So it is being done in that setting.
I see. So it is quite flexible then at the moment.
Yeah, that's right. That's right. At the end of the day, we want someone to get 2 doses of vaccine. So if they reacted badly to the first dose, with one particular type, then we'll use another.
I see. All right, Professor Sinanayake, as always, thank you very much for your thoughts today. Professor Kim here in the studio, thank you for your insights. And Dr. Kwok, as always, thank you for being with us. Right, as mentioned earlier, vaccinations for those between the ages of 18 and 49 here in the country are currently underway. So do seek to take active part in the ongoing campaign. Thank you for watching. See you on Friday.